Dear friends, we are seeing arthroscopy of the knee joint, and I am visualizing from the interlateral portal, and figure of 4 position has been put. There is a longitudinal tear of the lateral meniscus. In fact, there are uh, two tears longitudinally, and it is from the root of the just anterior to the root to the anterior horn of the lateral meniscus. You can see that when I pull it, it is coming in the intercondylar area. That means this is like a bucket handle tear. Longitudinal tears, if you extends, becomes like a bucket handle tear. But this is in white zone. So this is in the margin of the lateral meniscus. This white zone tear, if we repair with the remaining red zone or red white zone, the possibility of healing is not much. So this longitudinal tear, which is in the white zone, we have decided to do trimming or balancing of the meniscus or partial meniscectomy, and to look for the body of the meniscus, remaining part of the body of the meniscus, if there is any tear which can be repaired. So we are using the meniscus punch to trim the meniscus, and you can see that we are trying to trim from the anterior horn, and and the flap of the meniscus has been trimmed. We have removed, and the remnant of the meniscus has been trimmed with the shaver. You can see that the part of the meniscus at the root of the meniscus is a flap, which we will be using with the shaver. But then there is a hyper mobility of the meniscus we are seeing even after removal of this flap of the white zone or the margin of the meniscus. That means there is a separation from the capsule of the meniscus, which is extending from the hiatus of the lateral meniscus, popliteal hiatus. Means this is the tear which is continuation of the lateral meniscus hiatus, and there is a hypermobility, and also there is a tear at the body. So you can see that there is a capsular tear. So after we remove the white zone, there is a red white zone and red zone are the body of the meniscus and near the capsule. So now we will be using all inside type of device to make the repair from posterior to anterior. We can use from anterior to posterior or posterior to anterior, as this tear is behind the popliteus or from the popliteus to the posterior part. We cannot use any inside out needle or outside in type of methods in view of all the neurovascular structures in the lateral part of the meniscus, in the lateral meniscus posterior part. Now we have put one all inside type of device from the capsule superiorly and from the capsule to capsule inferiorly. So this will be our first stitch. We are now making the knot in the first stitch, and this gives us support at the posterior part, and we are now removing using the suture cutter. This we have cut the excessive thread. You can see that still there is a tear which is just lateral to just medial to the popliteus. This is a second tear, as I was telling. So this tear is going up to just anterior to the popliteus tendon. So we have to use all inside type of device for repairing of this. As I was saying, this is a continuation of the popliteal hiatus. We can anchor one of the stitches to the popliteus also if we do not have the capsule behind the lateral meniscus to make the the, the deployment of the all inside anchor. See, I'm going to the anterior part of going to the popliteus now. So first stitch will be taken just anterior to the red zone capsulomeniscus part at the level of the hiatus, which is going from the popliteus and going again posteriorly. So this makes one more loop in the meniscus. So this compresses the longitudinal tear. So this compresses the longitudinal tear. This is a longitudinal tear also similar to the horizontal tear. Also can be confused with the horizontal tear of the meniscus. So we have put the stitch like this. This is compressing the tear. We are tightening this. Now we can see the meniscus nicely reduced and compressed. The tear is compressed. Once it heals, it becomes like a normal one. However, the volume of the meniscus is the width is reduced because we have removed the white zone, which was a flap tear, which was in the avascular area initially to start with. After we complete the second stitch, will be now between the first and second stitch. The third all inside device is being deployed. So once this is from superior to inferior, we will be tightening the thread as we did for the first one and two. This completes the repair of the meniscus. Longitudinal lateral meniscus tear. You can see that very nicely repaired, and the contour of the meniscus is maintained even after we did the flap of the inner part of the margin, which is removed. Still meniscus retained its original shape and it will have complete functioning meniscus. Thank you.